Hello everyone. Today we will be discussing about hydrotherapy, also known as aquatic therapy. So, we will be beginning with the hydrotherapy. The hydrotherapy is a method of treating disease by using water at different temperatures and in different ways. Any activity performed in water to assist in rehabilitation and recovery from hard training or serious injury is a part of medicine, especially in physiotherapy, that involves the use of water for pain relief and the treatment. The term hydrotherapy encompasses a broad range of approaches and therapeutic methods that take advantage of the physical properties of water, such as temperature and pressure, for therapeutic purpose to stimulate blood circulation and treat the symptoms of the certain diseases. Hydrotherapy is the union between water and physical therapy. It is being used widely throughout the world as a form of physical therapy. By working in a hydrotherapy department of a physical therapy clinic, one may see how patients use hydrotherapy for treating their conditions. The patients are instructed through a specific program designed to help their physical conditions. The hydrotherapy is a great way to exercise the body. So we'll see the why water is useful for the rehabilitation. Water has a properties which can help enhance recovery from injury, surgery, and degenerative disease. It increases function and mobility of the joint and muscles. Water helps to reduce pain and increase the circulation. We will see the effects of hydrotherapy. Hydrotherapy affects the pain relief, the reduction in stiffness and swelling. It improves the range of movement in the limb. It improves the muscle strength. It improves the circulation. It improves cardiovascular fitness. It increases the mental stimulation. It improves the gait pattern and improves the quality of life or enhance the quality of life. The common condition referred for the hydrotherapies are dysplasias, hip dysplasia, elbow dysplasia, the osteoarthritis, the ACL injuries, cruciate ligament diseases, spondylolysis, luxating patella, weight loss, intervertebral disc disease, and CTRM. The goals and indication of hydrotherapy, the main goal is to facilitate the range of motion, initiate resistant training, they facilitate weight-bearing activities. It enhances delivery of manual techniques to provide three-dimensional access to the patient, to facilitate cardiovascular exercises, and to initiate functional activity replication, minimize risk of injury or re-injury during rehabilitation, to enhance patient relaxation. The physiological principles of hydrotherapy, the four most important properties of water from a treatment point are: water is a non-irritating, non-allergic, and totally compatible with human physiology, both inside and outside of the body. Six, water is a good heat conductor and at the same time greatly heat storing in capacity so that it is the ideal agent for manipulating the body temperature. We will see water is totally compatible to the body surfaces. This means that it makes an intimate interface with whatever it comes in contact, which greatly facilitates its ability to affect the temperature, the object it contacts. Next up, water is an inexpensive in spite of all its marvelous properties. In common with other forms, the physiological principle of hydrotherapy, in common with other forms of matter, water has certain physical properties which include weight, density, buoyancy, hydrostatic pressure, and surface tension. The most important physical law of water that physiotherapists should understand and apply when giving hydrotherapy are buoyancy and hydrostatic pressure. Buoyancy. Buoyancy is the force experienced as an upthrust which act in the opposite direction to the force of gravity. A body in water is therefore subjected to two opposing forces. We will see as the gravitational force is downward and the buoyancy force is upward. When the weight of the floating body equals the weight of the liquid displaced and the center of buoyancy and gravity are in the same vertical line, the body is kept in stable equilibrium. If the centers are not in the same vertical line, the two forces acting on the body will cause it to roll over until it reaches a position of stable equilibrium. As you can see, the buoyancy force and the center of gravity. The clinical uses of buoyancy is to decrease stress and compression to the body tissues, suppose as on weight-bearing surfaces, to assist the weak muscles. Next up is the hydrostatic pressure, the pressure exerted by fluid on body immersed in the fluid. As we'll see in Pascal's law, a fluid exerts equal pressure on all surfaces of body at rest. At a given depth, this pressure increases in proportion to the depth of the fluid. As you can see, if a body part is immersed in the fluid, the hydrostatic pressure will apply at a greater depth. The clinical uses of hydrostatic pressure. Water can have a similar effect as a compression bandages. It's helpful in decreasing the edema. Greatest effect of hydrostatic pressure occur in a vertical position. No hydrostatic pressure affects with non-immersion hydrotherapy. Therefore, the cleansing effect. Water can be used as a cleanser and hydrating effect and friction of water used to soften and remove the debris. Water is used clinically both as wound exudate or necrotic tissue and as a cleanser to remove the exogenous waste. The musculoskeletal effect. The buoyancy of a water unload the weight bearing of anatomical structures and allow patient to perform exercise with less trauma and pain. Buoyancy effect can help patient with decreased weight bearing, arthritis, increased blood flow to muscles, muscle strengthening, ligamentous instability, and other degenerative or traumatic conditions. The cardiovascular effect. The cardiovascular benefit of hydrotherapy are primarily due to the effect of hydrostatic pressure. The increased venous circulation, it increases the cardiac volume, it increases the cardiac output. The respiratory effect. Immersion of the whole body in water increases the work of breathing. Hydrostatic pressure on the chest wall increases the resistance to lung expansion. Water-based exercise is also often recommended to patients with exercise-induced asthma because it appears that high humidity of the air inspired during water exercise which prevent drying and or cooling of the respiratory mucosa. Renal effect, it increases sodium and potassium excretion, it increases the urine production and may be used to treat the patient with hypertension and peripheral edema. The psychological effects. Water immersion can be invigorating and or relaxing. The variation in the psychological effect depend primarily in the temperature of water. The clinical uses of hydrotherapy in superficial heating and cooling. Warm or cool water can be used clinically to heat or cool the superficial tissues. Advantages. Even contact with skin does not need to be fastened and allows the movement of the heat or cold. The disadvantages are extremely often can dependent position. Wound care. Cleansing properties facilitate rehydration, softening and debridement of necrotic tissue, removal of wound debris. Hydrostatic pressure and heat increases circulation. It provides moist environment to optimize the healing. Next up, the pain control. Increase sensory stimulation to peripheral mechanoreceptors. Cold water decreases the inflammation. It decreases weight bearing, increases ease of movement. Edema control. Water immersion has shown to reduce peripheral edema. This effect is due to the hydrostatic pressure. Contrast baths are frequently used to control the edema. The indications of hydrotherapy are control of pain and swelling, cold whirlpools, acute strain and strains, cold whirlpools, facilitate motion and exercise for subacute and chronic stages, sprain and strain, are warm whirlpool, facilitate of stretching and contracture, simultaneous or immediate pre-application of warm pools, post-surgical repair of joint after post-surgical wounds are healed fully to help soften scar tissue and pain and promote restoration of the movement. Indication: healing fractures of bone after clinical union has been achieved. Assist in the increase of mobility, thermal and buoyancy of warm whirlpools. Osteoarthritis and rheumatoid arthritis, buoyancy effect of warm whirlpool, offloading of the affected joint, leading to decrease in pain and an increase in the mobility. Help to boost, decrease the post-operative peripheral edema, hydrostatic pressure. The psychological effect, relaxation and decrease of anxiety. The wound care, mechanical debriding by removing necrotic material and cleansing. The contraindication are maceration, increased size of wound, bleeding in or near the area. The maceration is defined as the something of softening and breaking down the skin resulting from prolonged exposure to the moisture. The contraindications of full body immersion, cardiac instability, controlled, uncontrolled hypertension or heart failure, infectious condition that spread with water like UTIs, plantar warts, tinea pedis, severe epilepsy, increased risk of drowning, suicidal patients, increased risk of drowning. Contraindication and its rationales. Acute inflammatory condition, increase intravascular pressure and increase in edema. Hyperpyrexia that increases tissue temperature. Malignancy spreading the blood because of blood flow. Active bleeding, prolonged arterial blood flow. Cardiac dysfunction, not able to adapt to thermal homeostasis. Respiratory dysfunction, not able to resist hydrostatic pressure, tolerate heat or both. Decreased thermal sensation, inability to sense too much heat or cold. PVD, not able to meet increased metabolic demand. X-ray therapy, not able to meet increased metabolic demand. Venous ulcer may promote venous congestion, surface infection, cross contamination, uncontrolled bowel, contaminate water, dermatological condition, atopic eczema, exacerbate, severe epilepsy, risk of drowning, full body immersion. The precautions can be of local immersion, impaired thermal sensation, check temperature of water with thermometer first, infection, universal precautions, clean whirlpools, confusion, impaired cognition, use constant direct supervision, temperature of water near body temperature, recent screen drafts, neutral or mild warmth. It should be up to 96 to 98 Fahrenheit. The precaution of full body immersion is confusion, disorientation, to keep head above the water, constant supervision, low temperature, patient with limited strength, endurance, balance, range of motion. Hands-on approach required, patient on medications, physician clearance sometimes required, patient with fear of water, patient with respiratory problems. Watch for sign for respiratory distress, especially in hot or very warm water. Precaution and its rationale. Impair the thermal sensation in area to be immersed, burn. Infection in area to be treated, need additional infection control measures. Impaired cognition, not able to report problem or discomfort. Recent skin grafts may not be able to tolerate agitation or not able to compensate for extreme of heat or cold. After ingestion of alcohol, impaired judgment, risk of drowning, limited strength, endurance, balance, or range of motion, and full body immersion, safety hazard, risk of drowning, medications may alter in cardiovascular system. Urinary incontinence, full body immersion, risk of UTI, fear of water, may refuse to participate. Respiratory problems can increase the respiratory distress. Multiple sclerosis can increase fatigue and weakness. Poor thermal regulation can increase the risk of thermal shock. Previously existing edema can increase edema. Seasickness, which causes anxiety. The application of hydrotherapy, general rules and application to assess problem and set goals of treatment. To determine if most appropriate treatment, make sure no contraindications are there. We select appropriate form of hydrotherapy as whirlpool, Hubbard tank, contrast bath, non-immersion device, pool. Explain the procedure, purpose, sensations. Apply appropriate form of hydrotherapy. Assess the outcome, document it, and then with thus followed by the management part. The selection of hydrotherapy means select the appropriate form of hydrotherapy according to the condition to be treated, desired treatment effect, size of area to be treated, allowance for safety, control of infection, and its cost effectiveness. Water immersion modalities are whirlpool bath, Hubbard tank, pool, and aquatic therapy. As you can see, the whirlpool bath, Hubbard tank, the extremity whirlpool, high boy whirlpool, low buoyancy whirlpool, shear for whirlpool. Whirlpools. These are the stainless steel tank of various sizes. It has an attached motor called turbine. The turbine agitates the water in the tank to create the whirlpool effect. These whirlpools are intended to use a single patient treatment and must be drained and cleaned after each use. The whirlpool part in general: agitator, turbine ejector, aerator, hot and cold water mixing valve, temperature gauge, gravity drain, seat or chair. Parts of a whirlpool bath: it has an on and off switch, it has a motor pump, turbine motor, it has a thermometer, it has a tank of a stainless steel, it has wheels. Objectives for use: stimulation for circulation, promotion of muscle relaxation and pain relief, debridement, facilitation of exercise. Low buoyancy whirlpool tank: it is designed for ease of transfer in and out of the tank by virtue of low walls and length. Patient in a low buoyancy are used in long sitting position. The dimension width are 24-inch, length 52 to 66-inch, depth should be 18 inches. High buoyancy whirlpool tank. It also referred as a high HIP tank. It requires a chair for lift to transfer the patient in and out of the tank. Patient in a high buoyancy tank usually sit on a removable seat attached to rungs on the side of the tank or may sit on a chair outside the tank with their lower extremity dangling in the tank. High buoyancy whirlpool dimensions are width 20 to 24 inches, length are 36 to 48 inches, the depth is 28 inches. Extremity whirlpool tank. The whirlpool tank is smaller in size and designed specially to treat distal extremities, ankle, foot, and hand. It is often portable with attached wheel for ease of movement. Yeah, as you can see, the extremity tank. The dimension of the extremity tanks is 15 inches, length 28 to 32 inches, depth 18 to 25 inches. The Hubbard tank. These are the large whirlpools designed for full body head out immersion and for patients who are unable to stand. Mainly designed for underwater exercises. The wide top and bottom and narrow middle allow room for exercise for the extremities and patient and access to the patient for assistance with exercise. Patients are typically lowered into tank on a stretcher by an overhead hydraulic hoist. It is equipped with two turbines that can be moved around the perimeter of tank to direct and control the agitation pattern. The Hubbard tank dimensions are length 7 feet to 2 inch, upper wing width 6 feet, middle wing width 35 inch, lower wing width 4 feet 2 inches, depth 22 inches. The additional equipment are walk-through, adjustable seat, motorized chair, lift, hydraulic stretcher with hydraulic lift. The non-immersion technique, irrigate technique, are the pressure water irrigation system. It is mainly used for wounds where it is possible or not required to immerse the body part treated. It should be range between 4 to 15 pounds per square inch. Used to treat one patient at a time, and it is reusable. The whirlpool is recommended for its therapeutic effect as wound care. Delayed primary wound that are surgically closed after 5 days. Secondary intention, wounds are allowed to close by granulation, marginal or budding. Epithelialization and wound margin contraction. Therapeutic effect of wound care includes whirlpool application facilities, cleansing, softening and debridement of necrotic tissue, removal of wound debris, antibacterial action, circulation enhancement. The whirlpool can be carried out until the wound closes. The therapeutic effect of exercise in water. First, the relief of pain and muscle spasm, maintenance or increase in range of motion of joint, the strengthening of weak muscle and an increase in their tolerance to exercise, the re-education of paralyzed muscle, the improvement of circulation. The therapeutic effect of exercise and water again in the encouragement of functional activities, the maintenance and improvement of balance and coordination and posture. Wound healing is enhanced, sedative effect of relaxation. Facilitate cardiovascular exercises. Each facilitates the weight bearing activities. Moving on, the application and general use, we assess problem and set goals for the treatment. We determine if most appropriate treatment. Make sure no contraindication. Select appropriate form of hydrotherapy. As we have discussed earlier, here the selection for hydrotherapy are based decision on desired effect, size of area to be treated, allowance of safety, and cost effectiveness. The temperature ranges 32 to 79 degree for acute inflammation, tepid 79 to 92 degree exercise, acute inflammation if cold not tolerated, neutral warmth 92 to 96 for open wound, medically compromised patient or decreases tone. The temperature range mild warm 96 to 98 degree increases mobility or burn, hot 99 to 104 causes relief in pain or increased range of motion, increased soft tissue extensibility, very hot 104 to 110 limited body area, chronic conditions, do not use whirlpool at temperature more than 110. Safety consideration for hydrotherapy. Prevention of fall, precaution for prevention of drowning and electrical safety. Treatment duration of whirlpool is 20 minutes when strictly used as a heating modality, skin, muscle, and joint temperature. 5 to 20 minutes when used for debridement, depending on amount of necrotic tissue. 20 to 10 minutes for exercise, depending on patient medical status. Low extremity or mid-thorax level immersion technique. In the high buoyancy tank, it requires the patient to flex their hip and knees and limit the amount of range of motion exercises. But its depth allows a greater body surface area to be submerged safely and comfortably to as high as the mid-thorax reach. Low buoyancy tank that not deep but allows the patient to fully extend their lower extremity and perform full range of motion exercise. Extremity tank when only distal portion of the lower extremity has to be immersed that allow the extremity tank with use of chair will be appropriate. The upper extremity technique. The patient should be seated comfortably next to the extremity tank with a towel or other form of padding on the tank edge to avoid compression of axillary area. The full body immersion or Hubbard tank. Example, the patient with arthritis is unable to negotiate transfer. Patients with neurological involvement, paralysis, can actively remove the limb in water with the help of water and unable to do the same in the air. In a burn patient, an elderly patient with an open wound. Key treatment parameters to be documented in patient file after hydrotherapy. Patient skin, thermal sensory discrimination testing, skin status, health and mental status, hydro equipment, accessories, water temperature, water additives, name and concentration of solution, body part treated, if immersion, level, partial or full, immersion duration. Next, moving on to the aquatic equipment is used to provide buoyant support to the body or an extremity challenge or assist balance and generates resistance to movement by adding or removing equipment. The practitioner can progress exercise intensity. Here we're gonna see some aquatic or hydrotherapy exercises as follows. These are the things used for the aquatic exercises. There we have buoyancy belts, swim bars, hand paddles, pins, and boots. In stretching exercises, we have patient may tolerate immerse stretching exercises better than land stretching because of the effect of relaxation, soft tissue warming, and ease of positioning. However, buoyancy creates an inherently less stable environment than the land. Manual stretching is typically performed with the patient supine in waist depth water with buoyancy device at the neck, waist, and feet. Alternatively, the patient may be seated on steps. Here we can see the cervical flexion in water. The body is halfly immersed, and we have done the treatment. The shoulder flexion, again in half immersed water. Here we can see the dynamic trunk stabilization, the aerobic conditioning. The aerobic cardiovascular exercise typically takes place with the patient suspended vertically in deep water pool without the feet touching the pool bottom. Alternatively, activities that may be performed in mid level of water, 4 to 6 feet deep. The alternative activities that may be performed in mid-level water, 4 to 6 feet in depth, include jogging, swimming strokes, immerse cycling, and immerse treadmill. Next, we have the VO2 max compared to similar land-based exercise. During a low-intensity exercise, the cardiac patient may experience lower cardiovascular stresses as exercise intensity increases. As exercise intensity increases, cardiovascular stresses approaches those of related exercise on land. The physiological response to deep water, walking or running. Cardiovascular response. Patient without cardiovascular compromise may experience dampened elevation of heart rate, ventilation, and VO2 max compared to similar land-based exercises. During low intensity exercise, cardiac patient may experience lower cardiovascular stresses. As exercise intensity increases, cardiovascular stresses approach those of related exercise on land. This is all it about the hydrotherapy and aquatic therapy. Thank you.